Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and KUAR-FM 89.
Hello again, everyone. Thanks very much for joining us for another remote edition of our broadcast. Something of a paradox. Amid an epidemic, healthcare institutions, including hospitals and their employees, are among the hardest hit financially. And we'll get to that in just a moment. But first, even after the coronavirus outbreak established itself in Arkansas, the state was not shut down, not completely. And now it's beginning to reopen gradually and with some restrictions. But it was shut down long enough and hard enough to send thousands to the unemployment line and close hundreds, maybe thousands, of businesses. So what's the immediate outlook? Joining us now, Secretary of Commerce Mike Preston and Alan Hughes, President of the Arkansas AFL-CIO. Secretary Preston, let's begin with you. Where do we stand now?
Where we stand now is, it's not a great situation, but it could be far worse. I think you look at where other states are compared to Arkansas, and we fared a lot better in terms of how we handle this with relation to keeping as many businesses open as we could. Obviously, there were some that were forced to close, and others that, due to market conditions and lack of demand, had to close. But as we start to, hopefully turn this corner and see some reopening, we're excited to get some folks back to work. The demand is out there in terms of businesses wanting to reopen, and our goal is to help those businesses get back open so that they can rehire those employees, and that we can start to see those numbers on the unemployment benefits start to drop, and people get back into our economy, have a sense of confidence that they're going out and spending their funds again, having a sense of confidence that they're safe. And I hope that translates into our economy turning around, hopefully quickly.
The governor himself has acknowledged that there is significant economic and even political pressure to reopen. Are we reopening too fast?
I don't think we're reopening, too fast. I think we're doing it in a very measured approach that's driven by data that's being consulted with health professionals as to how we do it, and do it in the terms of that's going to keep people safe and hopefully not have too much havoc on our economy. If you look at where we are and say, when we say reopen, Arkansas for the large part did not shut down. There was not the shelter in place order given. A lot of businesses were able to stay open. Obviously, some had to close because of lack of customers. But I think we're doing it in a safe, sensible way, and I think businesses realize that, and they're taking the necessary precautions to meet those needs so that we can, hopefully be on a more accelerated path than other states on this.
All right, Alan Hughes, your thoughts on that?
Well, right now, so many people are waiting. First concern is safety. I've been on the phone this morning with several of our members, our international reps, and their first concern is the safety, available equipment, testing. They say they ought to be at these plants testing where they're forcing people back in. If it's a meat processing plant, if it's your store workers and stuff like that, they've given them a choice: either come back to work or we're going to let you go and replace you. I mean, it's sort of like Russian roulette with a two-chamber bullets, and both of them are loaded. Do you go back to work, try to make a living, or do you take this back to your family, hurt some of them, or hurt yourself, or keep spreading it? I hope it's not too early what they're doing, but it's concerned because this morning's news, 28 states have had a jump again since they started this. And then the unemployment situation, we've got people waiting 6 weeks to get their first check. They've been backed up. Why hadn't they manned that department the way it was needed to take care of the people? They go to open location one at a time. A lot of them are saying it's the rudest place they've ever been in. They ought to look at that as that's their customers. They ought to treat them with respect. They're the ones that's paying their salaries and stuff. But the major concern is safety. People being forced back. Are they getting equipment they need? Are they making sure? Several of them can't even get the numbers in the plant that they represent. The only way to find out is from co-workers. So they feel like they ought to be able to release this and give them a better idea to be able to monitor it.
Well,
And
there's two issues.
they all want the increase on testing.
Let me go back to Secretary Preston for a response on that. You got two issues there that President Hughes brought up, Mr. Secretary, and one is safety, and the other is the Bureau dealing with the process of obtaining benefits.
Absolutely, and safety. I think that's what I alluded to. That these businesses are looking to open in a safe, secure manner. The health department and CDC have put out very clear guidelines on how you reopen or how you stay open. As I alluded to before, Arkansas was very blessed in the fact that we didn't have a complete shutdown and a shelter in place. People were still able to go out there. Our state has fared way better than other states, not New York City. It's just a little bit different here in how we do business. And because of that, we have been able to keep a lot of these businesses open. These businesses want the economy to turn around. They want their workers to be able to come back and do it in a safe environment. Obviously, safety is first for these employers as they bring their employees back. If there's not a sense of safety, then obviously those employees are going to be concerned about it, and the consumers aren't going to be there as well. So safety is very top on the list of all these businesses who are looking to reopen. Why we've made funds available to businesses to help them cover some of these costs. And then in terms of the unemployment benefits, Arkansas, no state anticipated the jump in unemployment claims that we've seen across the country. I think Arkansas is doing its fair job in making sure that we're getting benefits out. What the gentleman referred to about the waiting period is that the CARES Act provided a brand new category and classification of unemployment that had never been covered before, and this is the independent workers, the freelancers, the self-employed, the gig economy workers. When we received our guidance in mid-April, it required us to build a brand new system, one that we can make compatible with our current system for traditional UI benefits, which required extensive testing to make sure we got it right. And in a couple of weeks' time, we were able to turn that around, build a brand new system, and launch that. And as of this week, that system is launched. People are now able to go in and claim their benefits. They can go back and get backdated payments to when their business was impacted to the downturn of the economy. We're paying already now close to 100,000 unemployment benefit checks this week alone. So Arkansans are receiving those payments, which, unfortunately, we don't want to see that many people in the unemployment line and receiving these checks, but that does mean that funds are getting out to them and that the funds are starting to move again throughout our economy. Our goal, our hope is that we get these businesses back open, that employees are able to go back to their employer and start working again in a safe, secure manner, and then we reduce the numbers of folks that are on unemployment.
Alan Hughes, it was an unprecedented situation in terms of, was it not, in terms of the applications, just the sheer volume of applications for benefits?
Oh yeah, it's backlogged. I mean, I know they're loaded, but they know this is getting worse. I mean, why hadn't they increased the people working at those locations? I know they had a problem with the programs, but these people are getting foreclosed on. They're losing their vehicles, their power's cut off, their water. Next burden is they have to go back and pay another deposits because the water's cut off, or their electricity, or things like this. It's brought more hardship on them because of the delay.
We're going to take just a second here and give you an example that of one small businessman, a well-known little Arkansas restaurateur, and his thoughts on reopening.
Okay, here's part of the problem with dine-in. But they said you could have 30% of your normal seating open, and they've got to be spread apart, and you've got to have a way that they've got to come in one door and out the next. And we'd probably put up air doors on the way in that weren't loud, that heated and cooled, where you didn't have to open a door and you'd walk through the air door. Then we would have to have somebody greet you and have the ability to go seat you at one of those 10 tables and keep social distancing. Depending on our technology, we're going to have the ability to put a TV screen in a dining room that's large and offer a limited menu where they can pick from maybe 5 menu items a day, and that can rotate to where you don't have to touch menus, because touching the menus is another problem. You've got to sanitize them in between. The customer can look at the screen They can take their smart device, actually place the order on their device, pay for the order on their device, and put the order in. We'd know what table it was, so we would have a certain amount of employees that could run the food at a distance and deliver it to the table and not have to exchange money with them. Problem you've got, though, is when you've got these large restaurants and you're not built with segregated dining rooms that have different air filtration systems, you got 40,000 tons of air conditioning running in a restaurant in August. Believe me, the utility bills are unbelievable. $6,000–7,000 worth of utilities to open the door. Now, it's a little bit less if you run less tables. If you restrict your hours down, you can trim that down some. Oklahoma, one of the regulations, you had to wear a mask as a customer to come in. But there's been some outbreaks from customers that feel that their civil liberties are being damaged because they're being told they have to wear a face mask. So we're going to let those challenges happen with the dining rooms that are going to open and deal with the challenges where we can put out great food and great product to our customers on a pickup slot delivery where they know the food's great.
That's one entrepreneur's thoughts on reopening. You can go online, by the way, and see another example that we were able to capture. Secretary Preston, back to you now. For one last question, if individuals choose not to return to work, they could, we are told, conceivably lose their benefits. Is that still the case?
That is the case. If you are given the opportunity to go back to work, and your employer has called you and offered your job back, and you refuse to go back, and then you go on your unemployment claim the following week and check that you are still filing and were unable to go back to work, then that is a fraudulent claim. And if that is the case, then we will investigate the claim. Now, obviously, through the CARES Act, there's some caveats related to COVID-19 and those impacted in certain ways. But if you are, able to come back and you don't, and then you still try to claim the benefit, it is a fraudulent claim.
All right, Secretary Preston, thanks very much. We understand that you've got a meeting to go to, so we'll excuse you. Alan, I'm going to come back to you, Alan Hughes, just a second. Secretary Preston, thanks very much for your participation. We know you're due at a meeting. Now, Alan Hughes, back to you, your response.
What happens to these people that's working two jobs at restaurants or somewhere else? Maybe they're getting to work at one, the others laid them off, so they've cut back. They can't draw unemployment because they're going to get denied because they got another job over here, but it's not paying nothing like they had. What about those people?
That's something that's unique about this pandemic unemployment assistance and that we've never seen before. Part of why it took so long to build a brand new system from scratch, because there's all these new scenarios that we have to account for. So there are circumstances where folks are working in a reduced capacity, but are still able to get unemployment benefit.
Alan,
the other question I had was, if testing's so important, why aren't they testing these plants, saturating them where they're making them work, forcing them into that situation, and try to control it there instead of going at random out in the public, people driving up and doing testing? I'm all for testing, but concentrate on the heavy areas where we're seeing the jump in.
Gentlemen, I have to end it there because we're simply out of time. Unless Secretary Preston, you've got a rebuttal. You want to do that?
I just say that I have a lot of confidence in Dr. Smith and the health team at the state and the governor's guidance. I think you've seen the push for additional testing. I know the governor laid out the objective to have some 60,000 tests done in the month of May, and this is obviously to help us to get back to work and have that sense of security for those employees and those employers. So we are heading in the right direction there. Thank you very much.
Thank you. With that, we have to wrap it up. And we're back. Small hospitals were facing serious challenges even before COVID-19 arrived, with elective surgeries and other procedures suspended by state officials and the fear of contagion keeping away many patients who might otherwise have sought hospital care. Even the biggest hospitals in Arkansas have been compelled to furlough employees and search for other ways to reduce expenses, even as the cost of treating patients, especially those requiring intensive care, have continued to increase. Joining us now for an assessment of the hospital situation in Arkansas is the president of the State Hospital Association, Bo Ryall, and Rex Jones, who is CEO of Magnolia Regional Medical Center in Columbia County. Gentlemen, thanks very much for being with us. Mr. Ryall, let's begin with you. The outlook right now for hospitals across the state is pretty stressful, strained, if you will.
It certainly is. I will take you back to the month of March. The first 2 weeks of March seemed like semi-normal, I guess, compared to where we are now. But the last 2 weeks of March, as you mentioned, we saw a reduction in the postponement of elective surgeries. We saw social distancing have its full impact. So over that time period, hospitals spent a lot of money preparing for COVID-19. And at the same time, business was down. So hospitals spent $34 million, according to a survey that we just completed, on COVID-19 preparations. That's additional equipment, supplies, building onto the wing of a hospital just to have a COVID-19 wing. So those funds, $34 million. But then also when you look at amount of financial impact and losses that we saw for March and April, $271 million just for Arkansas over that 2-month period. So a significant financial impact on Arkansas hospitals.
Well, we're talking about public and private, UAMS, the Baptist system, practically every institution in the state, a hospital in the state, is stressed right now, or are there exceptions? Is this across the board?
This is across the board. It's small hospitals, it's medium hospitals, it is large hospitals. It is affecting everyone.
All right, Mr. Jones, let me go to you. Describe for us the impact, the situation that you find yourself now in Columbia County, Magnolia.
You know, for us here in Magnolia, we were, like a lot of small hospitals, we were already feeling the major shift in how hospitals are operating over the last several years, operating at a negative margin, much like most of the small rural hospitals, not just in the state of Arkansas, but across the nation. And operating at that negative margin and then being hit with the COVID crisis on top of it, just the preparation of and the expense of trying to get the PPE equipment to have it available whenever we were going to need it, making some shifts and arrangements in how we were providing the care for the patients, and preparing for that was an expense. So whenever the COVID crisis hit and immediately the patient volumes dropped, we saw almost an immediate drop in our clinic volumes of over 50%, our outpatient volumes over 70%. And then talking with other colleagues at their facilities, they were feeling much the same thing, and they were seeing devastating losses. And when you're operating on such thin margins, it's difficult to have any reduction in revenue coming in. And the patients did a good job. They listened to us and said, when we told them to stay home, they listened to us. Unfortunately for us, that didn't help our revenue and our bottom line. We made the hospitals, and we appreciate the Hospital Association helping with this, but we made a plea to the governor and let him know that, you know, in small rural hospitals, those elective cases are what sometimes keeps us open. You know, that's one of the few things that there is a margin on that we can appreciate and put to our bottom line. And they were thankfully able to make some exceptions on the elective cases for small hospitals and critical access hospitals. But even with those exceptions, a lot of patients elected to not have the procedures done. So even though the exceptions were made, we still felt a major hit to our surgery volumes.
In terms of acquiring, Mr. Jones, the PPE, the protective equipment for your clinical staff, for patients as well, what kind of an ordeal was it? I mean, we've heard nightmarish stories from across the country.
It was extremely difficult. You know, as soon as we heard this was going to happen, we tried to jump on and try to get some additional PPE equipment in. And even though they were saying, you know, it's going to be available, it was very difficult. And what we were ordering, we may get a tenth of what we ordered. And so we immediately here took the approach, following the CDC guidelines, for minimal utilization of PPE equipment and started the using the CDC guidelines of minimal replacement of PPE. So we didn't burn through our N95 masks quickly because we were using them longer than what they're originally intended for. Certainly safe, but we started the approach very early on that it looks like PPE across the nation is going to be a major problem, and if we don't conserve right now, we're going to run out. We're just now getting to the point where it's easing up and we're getting most of what we order, but we're still like a lot of places, not quite where we need to be.
Bo Ryall, hospital administrators and other executives across the country have faulted or have blamed the lack of what they call a national strategy for dealing with this COVID-19 crisis. Do you concur with that? It's essentially been left to the governors.
It really has. And what we saw here in Arkansas from our governor's done an excellent job, but he became chief procurement officer for the state of trying to procure PPE equipment. And so what we heard was different times of being outbid on ventilators, being outbid on PPE by other states that put more money into the system and were in more urgent need. So that left Arkansas in the lurch as far as PPE and ventilators at some points. So yeah, it would have been better to have a coordinated effort from the federal level to acquire these and distribute these. We have seen some of that, but I think we could have had more and it would have been a better system.
Mr. Jones, to you, you have a similar view?
I do. I think the PPE procurement was probably the biggest thing I think could have gone a little bit better. I think the strategy that I've seen from the administration of pushing some of the decision making for how to open the states and how to try to go back to a normal life and the social distancing. I think that's probably wise to allow the governors a little more latitude in that because they do know the states better than the federal government does, and even within the state, they know the counties better. And I don't think it's a one size fits all. And so, giving them some latitude to make those decisions, I think is certainly appropriate, and I appreciate that. But having a system in place in the future for the PPE procurement and the ability to have a design in place to put that out where it needs to be in adequate numbers is something that does need to be worked on. I think they are.
And I want to touch on this. There is word or the administration, the Trump administration has made clear this past week that it intends to press forward. The case is now before the Supreme Court, and that is a complete and total reversal of the Affordable Care Act, Obamacare, as it will. Bo Ryall, what's the Hospital Association's position on that?
Well, the Affordable Care Act has been in place for a while, and certainly here in Arkansas that we passed our version of Medicaid expansion, Arkansas Work, which covers about 250,000 people who otherwise would not have insurance, and then also the more insured that we're seeing under the Affordable Care Act. So at this point, we're supportive of the Affordable Care Act. It covers a great number of people here in Arkansas. And without that, that would go directly to the uncompensated care of hospitals and would certainly lead to more financial losses for hospitals if we had less insured people here. So we would be against a reversal on the Affordable Care Act.
Rex Jones, the immediate impact, as it were, on your hospital, should it simply go away?
The Affordable Care Act?
Right.
It would be tremendously hurtful for our facility. We were very fortunate in the state to piggyback off that Affordable Care Act with the Medicaid expansion program. And I came from another state before I came to Arkansas that chose not to participate in the Medicaid expansion program, and they have closed several hospitals in that state. And I think that if this were to have a reversal without, as Bo mentioned, something to backfill that pool of uninsured patients, it would have a devastating effect on all of the small hospitals. Absolutely.
Gentlemen, we have to end it there because we're simply out of time. Rex Jones, Bo Ryall, thank you very much for your thoughts and coming on the broadcast. We'll have you back. Thank you very much, as always, for joining us for Arkansas Week. We'll be back next week.
Support for Arkansas Week provided by the Arkansas Democrat Gazette, the Arkansas Times, and KUAR FM 89.